This is my reflection over my first rotation at Lutheran Outpatient and the first half of my rotation at Ankeny Centennial. So far, I guess let's start with Lutheran Outpatient. Let's say overall my grading of myself was pretty fair when it came to the Lutheran Outpatient. I'm looking at them side by side right here, and Angela gave me actually she gave me better scores than I gave myself. So I guess I might have been a little too hard on myself, but that's a good thing though. So it's a good thing because I mean I believe I did things well, but there were some things I probably could have done better. But I mean, even though there really wasn't much I was doing besides observing and then putting in my input from time to time on suggestions I have about different diagnoses from initial patient diagnosis from the workman comp section, or different rehab thoughts of what exercises they could do. I mean, there wasn't much I could do. Like I said, they're trained physical therapists. I'm just a student. Getting to the last section of the reviews I had, I mean, I said my patient-centered care was advanced beginner. Interprofessional practice would have been competent. I think I did what I did well in the clinic setting. Evidence-based practice, novice. Like I said, I'm just starting out. Quality improvement, I'd say advanced beginner, and healthcare informatics advanced beginner. Still need to work on a lot of these things. Only thing that Angela gave me rated, everything else seemed not to be not demonstrated, but evidence-based practice, which she gave me a novice as well. So those two tied together. And looking at my strengths, I said coming up with physical rehab progressions for the lower extremity. I think that I'm doing well on that, trying to tie together the different muscle groups and how they function and how to work them out. I'd say that's one of my strengths right now. Looking at Angela's describing my strengths, she said she thought I did well within the boundaries of what I was able to do, asking good questions, different things, making sure that I'm actively trying to learn anything I can within the rotation and anything that goes on with it, so that way I can actually get something out of it versus me just sitting there. So I and she specifically said because he has early education regarding the rehab portions, he is now required to complete care. I mean, that might be a little bit more different for Kelsey or Josh, but that's really the only thing she said, that I was very engaged in whatever she was doing to understand fully what was going on. Like I said before, understanding cognitive rehab is one of the things that I think I need to work on. It's just, I feel like right now I'd push an athlete too hard versus what they probably should do, and understanding the progression levels of what the return to play should be for anything cognitive. I've talked with Pete about this, so that's my knowledge since Lutheran has improved. So going from not having headaches to a day to starting to do some type of workout without headaches, and then going into functional drills, sport specific, and then so on and so forth. So my knowledge has improved since working with Pete, but at the time when I was at Lutheran, I was very bad at it. Looking back on my professional development plan back at Lutheran, I believe I did a pretty good job of achieving my goals. My first one was, in my time at Lutheran, I want to create basic effective rehab techniques, and I think I've done that within my time at Lutheran, combining that now and putting those into function now at Ankeny Centennial. I think I've done a decent job of that, and getting a decent bedside manner, so that way I can interact with the patient in an appropriate way and in a professional way, so that way they feel comfortable with the situation and me diagnosing them. As far as my educational goals, this semester, learn about many rehab methods and develop creative ideas of sport-specific recovery. I think I've done that somewhat. Like, as we keep talking about different sports and everything, I'm starting to piece together what I could do to make things functional rehab for them. So even when I was at Lincoln, I was helping do a functional concussion rehab for a basketball player, just having them do different drills and cutting, and then even doing some conditioning at the end, so that way I could see if their exhaustion would start their headaches again. My second goal for education was refine my basic knowledge of wound recovery process and implement that in the clinical semester. I think I've done that pretty well so far. My grades this semester have reflected that. I think I've started off on a better foot than I did last semester, and I plan to keep that going. And lastly, for my personal goals, is be more critical of myself and my assignment quality this semester. I believe I've done that. I understand where I need to be and what I need to do, and then continue to read the chapters, refine my knowledge. I kind of fell off on that one. Now I'm going to talk a little bit more about my first half with Pete. It's been going pretty well. I've learned a lot from him and how he does things, and the main thing I'm trying to pick up on is soap note taking. He has a pretty refined method of soap note taking that I can learn a lot from. It doesn't really have a structure to it. He has developed his own method of doing it, so that way he could just write everything down and get it down. I mean, if I could do that, that would make things a lot easier than just having to go through and have a list saying everything I need to do, versus me learning what I need to do and then implementing it into my own kind of list. So that way I don't have to follow a structure. The structure would be my knowledge and what I know as far as documentation. With that being said, my only goals have changed are my clinical ones. The other ones stay the same because I still have the same goals for my personal goals for the semester and classroom goals. So my clinical goals would be more confident in my evaluation and diagnosis of injuries and my remaining time in ankling. I want to become, so I mean, I know what to do. I know what I need to do as far as when I'm looking at an injury. I know what all I need to test for. I just have to become more confident and more sure of my findings and use that information to give me more thoughts on what I should start looking for now. Another thing I need to do is refine my knowledge of the muscular anatomy and translate that into effective rehab stretches. Pete showed me like things I'd never even thought of, like changing the rotational angle of your femur so that way you could stretch different parts of your quad. I mean, I just never thought of that, and it's something I guess I pick up along the way and as I get more experience, but I just need to start looking at the body more to understand that there's more functional ways of stretching. And my last one, obviously, is improve my documentationist soap note taking efficiency. Like I said, I can get it. It just isn't as smooth as I'd like it to be, and I know that'll come with experience. And this has been my reflection of my first 2 clinical settings.